What does IBS mean to you?
Irritable bowel syndrome,
More than that?
chronic pain not going away,
And?
constipation,
And?
difficult to manage patients.
So IBS means to me that patients come in with variable symptoms of constipation and diarrhea alongside abdominal discomfort.
It is a syndrome of exclusion. Nothing is quite fit for diagnosing or treating the patient.
I don't think we really know what the underlying causes are, but I'm not sure, maybe stress related or genetic components.
It's a really important medical problem for patients, and I think doctors need to take it very seriously, although sometimes don't.
Well, I think in-depth more understanding, it could be some inflammation of the inner lining of your colon.
A bowel disorder brought on sometimes by stress, sometimes it can be mistaken for other illnesses.
So it's a disorder of the bowel, so it could range different symptoms. People react differently with pain. They could have irregular bowel habits.
How do you explain to a patient what IBS is?
You tell them that whilst they haven't got anything worrying in terms of a very sinister pathology that can affect their life, you still sort of explain that you understand they've got an issue and they need long-term management.
I would say that in some people bowels are more sensitive than others. Some people are more aware of kind of how the bowels move or this sort of thing, and they can get stressed, and that can actually affect their bowel motions. Something like.
So I would think if I had to explain this to a patient, I would say that it's a condition where an individual's bowels may be more sensitive than the general population, and so can present with lots of different symptoms, which we manage with medications. Sometimes we can never figure out exactly what triggers it in that patient, although we do try and discuss things like diet.
So there could come in disturbances like diarrhea, anything, pain. Just it's kind of individual to the patient as well.
I might use bloatedness. I might use frequency maybe in your bowel motions. I might use pain, discomfort.
So how would I explain it to a patient is that patients often have episodes where they may be constipated, and also episodes where they might have increased stool frequency, flatulence, and or abdominal pain, which is often relieved by passing wind. These symptoms are intermittent, as I say, they fluctuate, and often we give medication as required to help symptoms of the discomfort alongside either the diarrhea or constipation as required.
Well, in layman term, to explain about the bowel habit, it could be in a diarrhea form or constipation or some sort of abdominal upset, bloating. I think I'll be talking more on the symptom, relevant to the symptom and what the patient can expect. And I think, I don't know, irrelevant to dietary or, can be caused by some sort of sensitivity to certain kind of food. But of course, it needs to be investigated to establish the diagnosis and things.
And finally, what are your top tips for treating IBS?
Actually, as I mentioned before, firstly, the patient should seek the advice of a psychotherapist. He should review his overall lifestyle as regards stress, as regards sleeping pattern and sleeping hours, and eating habits.
Getting the patient's ideas, concerns and expectations on board, and managing their symptoms as and when they present.
Doing a food diary and seeing if there's anything that might trigger it for an individual, trying to actually support patients.
some medications are just like antispasmodic. And if they've got diarrhea, they can use some. Also constipation, they can use some laxatives, heparin, nutritional supports. Maybe go to a dietitian for it, things like that.
So diet, if they notice if they've been eating something that's caused it to be maybe a flare up or something, that maybe just to kind of watch what they're eating, and if it's making it worse, just to try and stop eating it.
If there's any kind of, I don't know, red flags or any bleeding or any abdominal distension or severe pain, they should be seeking medical attention. And also go to their GP if there's anyone in the family have that. Maybe other family members can be investigated down and establish the diagnosis earlier than later.
I think it's largely based, obviously it's each individual patient with IBS will be treated differently. Some patients just need information about what is IBS and sort of helping explain what's causing their symptoms may be enough for them, and they may be able to live and tolerate the symptoms that they're getting. Other people, as I said, may need symptomatic treatment if they're having really bad episodes of diarrhea or really bad episodes of constipation, may need laxatives, etc. And also some patients are put on analgesia, such as sort of low-dose amitriptyline I've seen as well, to sort of help in terms of the abdominal discomfort symptoms.
It's looking for any signs of anxiety, seeing if there is maybe an underlying cause. Yeah. Obviously, if the symptoms persist, they will obviously possibly need to be investigated. I think stress is a major factor in a lot of illness, stroke diseases. And also to monitor their diet, what are they eating, etc. Some foods can exacerbate certain conditions. And it's about living well and see if your symptoms can be controlled on diet rather than, say, medication, whatever. And as I say, if symptoms get worse or persist, go back to their GP, and hopefully they would be referred to a gastroenterologist and maybe be investigated.